but I'm more likely to use that for the quiz. The lobes of the lung. Look at this. We got a fissure there that goes more horizontally, horizontal fissure. We get a fissure here that's cutting obliquely down across the lung. Not this. This is just where it comes apart here, but that's the oblique fissure. That's a horizontal. Right lung, superior lobe, middle lobe, and down on the side here, inferior lobe. Correct. What's this muscle?
Diaphragm.
Diaphragm, of course. What's the point up here?
The apex.
What is the point, by the way?
That's a good question.
Apex. Sitting on the diaphragm is the base. Now, more likely to ask the base off of that single one back there in the test. You know, whoops. You know what this fissure is?
Oblique.
There's only one, and that's the oblique on the left. Thus, we got superior and inferior lobes only. What's this notch?
That's the notch. Coronary
Yep.
notch.
Coronary notch.
Cardiac.
Cardiac. Cardiac.
I think it's just coronary. It wouldn't be, you know, it'd be heart. I imagine there's somebody who calls it that too, but we always call it cardiac. No?
You should call it the heart notch.
Because you can see, I want to show you something else here too, just for as long as we're here. You can see the apex of the heart sits over into that notch.
Mm-hmm.
Let's take the heart out too. There's the esophagus, there's the thoracic aorta. You can see some primary bronchi. What's the blue vessel?
Those are the arteries.
Arteries. Pulmonary
Pulmonary
arteries.
arteries.
Pulmonary artery. What's the red one?
Pulmonary
veins.
veins.
Pulmonary vein. You seeing that okay?
Yes, thanks.
There's the esophagus, the thoracic aorta, primary bronchus. I can even see the secondary ones there if I'm looking closely.
Which is this esophagus?
Right here?
It's like the orangey one.
This one, and then this is the
That's not
aorta.
respiratory, but I just thought I'd point it out. That's the thoracic aorta.
Yeah.
Right? That's the pulmonary artery,
Mm-hmm.
left lung, left pulmonary veins.
Mm-hmm.
Now the question is, what opening have I got between my index finger? It is my
Cardiac.
index finger, right? Yeah, index and thumb.
That's the
Cardiac.
notch. No?
Cardiac notches are over here.
Oh.
The pulmonary.
Starts with an H,
Oh,
ends with an M or an S, M in our case.
Oh, then.
Second letter is an I.
Hilum, something.
Hilum.
Oh, hilum. That's
Hilum
right.
of the lung. Because structures are going in, structures are going out.
Hilum, okay.
That's the doorway in and out of this heart. Do other organs have them?
Yes.
Yeah.
Well, we didn't name it, but when we did the lymph
lymph
node,
node.
the lymph node has a hilum. The kidneys have a hilum. Okay? And so on. And what are all these little, what do you call them? Little dimples in here representing?
The arteries and veins.
See, the texture of that is spongy looking.
So
Alveoli.
those little, yeah.
Oh.
Those little guys.
Bronchioles, all the other ways. We can't be distinctive there. We can see more of them over here,
Okay.
though. But the only thing you'd probably need to know here for the bronchial tubes would be primary and the secondary here. The right one's a little more confusing, but primary, secondary. Diaphragm. Going to go back a little bit in our studies. What vessel is that right there?
At the thoracic aorta.
Well, this is the
Is that the
abdominal
mesenteric?
aorta,
Oh.
and what's that branch right there?
Celiac.
Celiac, right? Is this going to go to the spleen? It's going to go to the liver, stomach, etc. So, that's that model.